Hi, everybody. I wanted to share an update with you. I've had some imaging done and met with Dr. Hanson today. I'm going to put it in my little teacher hat here. I'm going to put it on the background so you can see it. And this imaging is me in motion, which is pretty cool. And it's allowed Dr. Hanson to kind of get a better scope of what parts of my vertebrae and around my jaw and my shoulder girdle are the most problematic and where he wants to target. And we reviewed all of that today, which was really, really cool. And Dr. Hanson then will be treating these areas in our appointments that are coming up before we know it. And I'm like getting excited, it's coming. So the general plan that we discussed is day one of treatment will be focused energetically and co-treating with an acupuncturist. And I was just preparing my body for the injections. And then our second day, we will be doing the harvest of my bone marrow and some blood draws and getting some of the tissue ready, and then preparing my nervous system. So I'll be going through a series of different injections that are really designed to help me reset my nervous system. Because I've been in injuries really on and off most of my life, starting at age 11, I definitely live in like that fight or flight zone in my body a bit more. So this will help me not only prepare for the injections, but also really change the trajectory within my nervous system, and it really occur over the next year. And then day three is the big day where all of the injections will be done. And I'm kind of looking at the spine here. It's going to be right around the joints and then where there are ligaments, and specifically treating those. So there'll be anywhere between 60 to 75, maybe even more micro level injections. And what was really exciting news today after doing the exam and discussing everything, Dr. Hanson is going to go a little lower than he first planned. At first, he was only going to go around my first ribs. But because I have such significant challenge in my thoracic spine, he's going to go a little bit lower. We're still going to treat the thoracic spine more specifically in 2, 4, 6 months afterwards, to be determined. But then that will allow him for this first treatment to go a little bit lower and help my rib cage issue, which I'm really, really excited about. And we just talked more about like the multidisciplinary approach that I've been taking for many years now. And that made me feel really good that like I've been doing everything that I can to prepare for my body to function and feel differently. And now getting this missing component of actually helping heal the tissue itself. So really excited. The big days are coming up. July 15th through the 23rd are those 3 different treatment days. So I'll be laid up for a little while, but we'll give you some updates again. And thank you so much for donating. Brady and I were both just overwhelmed with gratitude, and we just really appreciate everybody who's been a support system, whether that be financially or within our friendships and family as well. So thank you again for that.